You do not need to drive to a lab in Dubai traffic just to get a blood test. In the next 10 minutes, I will show you, step by step, exactly how a blood test at home actually works in Dubai. Who is allowed to draw your blood? How your sample stays safe on the way to the lab? How fast you get results? And the exact questions you should ask any provider before you let them near your arm. I am Vesta, the clinical avatar of Vesta Care's clinicians team. And today, we are breaking down home blood testing in Dubai, the way our own nurses, doctors, and lab partner actually do it. No marketing, just the procedure, the standards behind it, and what you should expect from the moment you book to the moment the result lands on your phone. A home blood test is exactly what it sounds like. A licensed clinician, a nurse, or lab technician trained specifically in drawing blood comes to your home, your hotel, or your office. They draw the sample, label it, pack it under controlled conditions, and send it to an accredited laboratory. The lab then runs the analysis and releases the results to you digitally. Here's why this matters. Every step in this process, from identifying the right patient, to the way the needle is inserted, to how the tube is transported, affects both your safety and the accuracy of your result. A mislabeled tube, a contaminated sample, or a tube that gets too warm in the car can change what your doctor sees on the report. So the real question for you is not, is home blood testing convenient? Of course it is. The real question is the provider doing it to the same standard as a hospital lab? In Dubai, home healthcare is regulated by the Dubai Health Authority, the DHA. Only a DHA-licensed home healthcare provider is permitted to perform a home blood draw, and the person who actually inserts the needle must themselves be individually DHA-licensed, either as a registered nurse or as a lab technician trained in blood sampling. At Vesta Care, we are a DHA-licensed medical facility. Every blood draw is performed by a DHA-licensed clinician. For example, our lab technician Bara Shaker and our registered nurses, including Manpreet Kaur, Srithu Stephen, and Tinsi Fampan, are all individually DHA-licensed and trained specifically in venous blood sampling. Our medical director, Dr. Amal Ahmed, and our clinical team oversee all clinical protocols. Before you book any provider, check 3 things. 1. Ask for the company's DHA license number. 2. Confirm that the clinician arriving at your door is individually DHA licensed. 3. Confirm which lab with a separate DHA license will be processing your sample. You can verify all 3 on the DHA's public register, Sharian. A legitimate provider will never hesitate to confirm all 3. Probably the most common question we get is, do I need to fast? Here is the honest answer from our clinical team. Not every blood test requires fasting. The ones that typically do are fasting blood glucose, usually 8 hours, and a full lipid panel, where many clinicians still ask for 9 to 12 hours of fasting, particularly if your triglycerides have been high before. During the fasting window, you can, and should, drink plain water. Staying hydrated actually makes the blood draw easier because it helps keep your veins full. What you need to avoid is coffee, tea, juice, soda, smoking, and chewing gum. All of these can affect your results. For tests like HbA1c, thyroid function, vitamin D, most hormone panels, and a complete blood count, fasting is usually not required. At Vesta Care, when you book a test, our medical team, led by our medical director, Dr. Amal Ahmed, reviews your request and tells you exactly whether fasting is required and for how many hours. You do not have to guess. Let me walk you through exactly how a home blood draw is performed by a DHA-licensed clinician. This is the procedure our own nurses follow on every single visit. Step 1. Patient identification. When our nurse arrives, the very first thing she does is confirm your full name, your date of birth, and the test that was ordered against the laboratory request form. A mislabeled tube can lead to a misdiagnosis, so this step is non-negotiable. Step 2. Consent and comfort. She will ask you about allergies, whether you have fainted during past blood draws, and whether you have a preferred arm. You will be seated or lying down with a clean surface under your arm. Step 3. Hand hygiene and gloves. She performs hand hygiene, soap and water, or alcohol rub, and puts on fresh, single-use, non-sterile gloves. Step 4. Vein selection and site prep. She selects a large, firm vein, usually in the soft crease on the inside of your elbow, and disinfects the skin with an antiseptic. She lets it air dry. She does not wipe it off, because wiping it off defeats the disinfection. Step 5. The draw itself. She uses a single-use, sterile, closed vacuum tube system, the safer option because blood never comes into open contact with the clinician or the air. The tourniquet stays on for no more than about a minute, so it does not distort your results. Tubes are filled in a specific order to prevent the additive in one tube from contaminating the next. Step 6. Post-draw. Firm pressure on the site, a small dressing, and the used needle goes straight into a puncture-resistant Sharps container. Never recapped. Tubes are inverted the correct number of times for the additive inside, and labels are rechecked before the sample leaves your home. This is the step that separates a professional home service from a risky one, and almost nobody asks about it. Between the moment your sample leaves your home and the moment it is tested at the lab, 3 things affect your result: temperature, time, and handling. If any of the 3 goes wrong, the numbers on your report are no longer trustworthy. Most routine serum samples need to be kept cool in transit, typically between 2 and 8 degrees Celsius. Some tests are extremely time-sensitive, so getting the sample to the lab quickly matters as much as keeping it cool. At Vesta, samples are packed in a temperature-controlled transport box, labeled with the exact collection time, and delivered to our lab partner, Intel Lab, under chain of custody. Intel Lab is a DHA-accredited laboratory, operating since 2001. Every single result is validated and clinically correlated by a DHA-licensed clinical pathologist before it is released to you. That pathologist validation, as well as its clinical correlation, is one of the most important things to look for in any home lab service in Dubai. Most routine tests, a complete blood count, kidney profile, liver profile, thyroid, are reported between a few hours or up to 24 hours. More complex panels, such as extended allergy or food print testing, can take a few days. Your provider should tell you the turnaround time in advance. Results usually arrive through a secure digital channel, email, a patient portal, or WhatsApp with identity verification. And in Dubai specifically, your results should also be registered on the BEAD, the Unified Electronic Health Record System mandated by the Dubai Health Authority. This means any DHA-licensed physician treating you in Dubai can see your test history. That continuity is part of why NABEAD exists. One last thing, and this is important. A number on a report is not a diagnosis. Blood tests are tools that help your doctor make a clinical decision. At Vesta, every lab package includes a free teleconsultation with a DHA-licensed general practitioner to interpret your result. Do not self-diagnose from a PDF. Before I close, here is the checklist. Ask any home blood testing provider in Dubai these 5 questions. 1. What is your DHA license number? 2. Is the clinician who will draw my blood individually DHA licensed? 3. Which accredited laboratory will process my sample and who validates the result? 4. How is the sample transported? 5. Will a DHA licensed doctor explain my result afterwards? If a provider cannot answer all 5, look elsewhere. If you would like to see how we answer them at Vesta, the full Certis details are linked in the description below. I am Vesta, the clinical avatar of Vesta. If you found this video educational and maybe helpful, please do follow us, like and subscribe for weekly medical content delivered to you. or ask us any question in the comments section of our channel. We read them all, and we reply to everything we can be of use. Thank you for watching, and until the next time, stay healthy.